Hello, good day. I'm so excited to see you this time. You are welcome to another episode of my channel. Today I'm going to be talking about Catarrh. As I promised earlier, that I'm going to be talking about this to differentiate between these three in order to have a clearer understanding on it so that when you are battling with one of it, you'll be able to treat it or have a clear picture on it, both for those who are in school and for those who are still at home and for those who do not even go to any health school or have a clearer or more understanding on any health related topics. So it's really a great opportunity for you to grab and also to share to people who are in need of this. Right? So I've talked about cold, I've talked about cough, where we need to understand that cough is divided into two, productive and non-productive. So now I'm going to be talking about kata. Okay, some people are just interchanging it, as I said earlier. When treating kata, you will now be treating cough. When treating cough, you will now be treating cold. So that is not. All right. So what is kata? Quickly. So it just is this catarrh is a chronic or persistent inflammation of the nasal passages and sinuses, leading to excessive mucus production. Okay, so excess mucus production. Um, I just want you to follow me again because I said it's a chronic or a persistent inflammation. Inflammation of nasal passages, okay, and sinuses. When you'll be feeling some, your nose will be paining you sometimes, aching you, right? So it's a persistent inflammation of the nasal passages and sinuses, leading to excessive mucus production. That you will now be, having some nasal discharge and so on and so forth. Okay, now let me talk about the symptoms when you see such problems, when you see such things happening. So you'll be able to know that yes, this one is catarrh, not cold or not cough. You understand? Because I'm here just to differentiate them. Okay? So now, one of the symptoms that you will know that yes, this one is catarrh is a persistent runny or stuffy nose, a persistence of runny or stuffy nose, because it affects it, because I said earlier it's a chronic or a persistent inflammation of the nasal passages. You understand? It affects the nasal passage, because affecting the nasal passage, it will now result to either a runny nose or a stuffy, that is a blockage nose. And so also there will be a postnasal drip, that is a mucus dripping down the throat, a mucus dripping down the throat, okay? And there will be a sore throat and cough, often worse at night. You'll be able to know often worse at night. You'll be able to know that yes, okay, since there is a sore throat, there is a cough, and most especially at night, I've been battling with this, and there's a mucus dripping down the throat, and there's a persistence, either a running nose or a stuffy nose. So now you'll be able to know that yes, this one you identify that yes, this one is catarrh. Because for you to know the first line treatment of that, if you don't differentiate, and that is why we have been experiencing or having these problems, this complaint has been coming. Someone will now say, Kai, I took so medication now for quite a long time, but yet there is no any good response. So, and that is why I'm taking this time in order to explain so that we will know what causes this and what is the first line treatment in order to get rid from that, and what causes this in particular, that is the catarrh. Sometimes it causes by allergies, it causes by sinus infection, because when you have a sinus infection, it will result to catarrh. And another thing again is irritants, such as smoke. Smoke actually affects smoke affects person that will eventually or it will lead to excessive mucus production. That is catarrh. It will result to a persistent inflammation of the nasal passages and sinuses. Okay, and another one again, such as this irritant, it could be smoke, as I said earlier, it could be pollution, and it could be hormonal changes. When the hormones change, it will result to catarrh. You understand? And that is why sometimes a pregnant woman will not be battling with catarrh sometimes, because there is a hormonal changes. There is a changes in hormones. So that will result to that. Okay? Now, I cannot just explain and tell you the causes without the treatment. So now, what would be the first line treatment of this? Okay, just stay tuned and continue to help me share for in order you can see this is the example of cough. And now you need, in the first line treatment of this, you will need what we call antihistamine, because these antihistamines, in order, it helps reducing the allergic symptoms. It helps in reducing the allergic symptoms. It will help in order, it will help to reduce the allergic symptoms. And another one again is nasal corticosteroid will be needed. This nasal corticosteroid sprays, it helps in reducing the inflammation. Because I said earlier, just let's go back from the definition. I said it's a chronic and persistent inflammation, a persistent inflammation of the nasal passages. Because if there is that, uh, inflammation of the nasal, this spray helps to widen or to help in order to reduce the inflammation of that nasal passage. And another one that will be needed under this first line treatment is saline nasal irrigation in order to clear the mucus. If peradventure, sometimes at night you are having difficulty in breathing because your nose is blocked, so you will need this saline nasal irrigation in order to clear the mucus in your own nostril. Why? Such as this is Otrivine, because Otrivine is a drop, it's a nasal drop, it's a saline nasal irrigation drop in order to, that used to clear the mucus. Okay, then another one again in treating this is avoiding a known triggers. Always avoid a known triggers that you know, such as some of the allergens or irritants, where you know that okay, where you smoke, it will result to that. Where where you do something of that nature, or you are involving yourself into any activity that you know it will trigger it, a known one to you, please just avoid that. Okay, avoid it. So this is for now. If you have any question, any problem, you can just put it at the comment section. Okay, and that will actually help us from now and from you to the other people that actually in need of that. So please, let's continue to share and continue to have a more clearer, continue to like it for you to have a more notification when any video is being posted.